Hello, I'm Dr. Shreedevi and today I will be talking about the swelling seen in your anal areas. So today a lot of people have asked me about swellings in the anal area. So they ask me questions such as, I have a very small swelling just near the tip of my anus. Should I do something about it? It doesn't cause me any pain. It doesn't cause me any discomfort. There are also some people who say that they have swellings in the side of their anal region, which grows in size once in a while and then it just, either disappears on its own or sometimes it bursts open to release some pus and then it becomes normal and they don't have trouble for months and then again it starts all over again. And some people say that when they eat certain sorts of foods, like if they have very spicy or non-veg food, they notice that they develop swellings in that area and then it goes away on its own. So what should they do about it? So this is a very common question we receive. So today I'm going to talk about what are the various swellings in the anal area and why do they occur, what is the cause for these swellings, how do we treat them, who should treat them, and also what we can do to prevent these swellings. So coming to what are these swellings? So as you can see, these are the common causes for the presence of swellings in the anal area. The most common reasons are skin tags or fistulas and abscesses. So these are directly in connection with your anal canal. So these are resulting due to problems you have in the anal area. So if you have constipation or if you have developed an infection around the anal area, then you can develop either skin tags or fistulas and abscesses. So these skin tags do not require treatment, but fistulas and abscesses definitely require surgical treatment. There can be other reasons such as skin conditions, which are warts or simple furuncles, which may be a result of skin infections. Now coming to the treatment. So who should treat? Most people, when they have a swelling in the anal area, they do not take proper treatment. They try to treat it on their own. So first they will try home remedies like drinking lots of coconut water or buttermilk. They think that they have a very heat body. So they will try and consume more liquids or cooler salads and items that will help them reduce the swelling. So when that doesn't work, they will go to their local pharmacist, not even a doctor. They will go to the pharmacist and try to get some prescriptions or medicines from them to reduce the pain and swelling. And even when that doesn't work, then they go to their local doctor. So if you visit your local GP or gynecologist and if they have seen such similar cases, then they may treat you accordingly. But otherwise, the best person to go to when you have a swelling in the anal region is a surgeon. So what the surgeon will do is they will examine you, they will figure out what you have, whether you need treatment for it first of all or whether it can be left alone. So when you have a swelling in the anal region, please do not hesitate or please do not try to guess the treatment on your own. Go and show it to a surgeon. The treatment may be simpler than you think. So what are the treatment options? So the treatment options depending on the cause. So for example, skin tags do not require any treatment. If you do not have a pain, if you do not have any bleeding, if simply the swelling is your problem, then it may not require even removal. So you can simply be left alone and it will not cause you any problems in passing stools. But again, something like a fistula or an abscess cannot be treated with medicines no matter which place you go to, which hospital you go to or which country you go to. So there are certain conditions like fistula which will require surgery. It may be a direct surgery or you may need some medicines initially followed by a surgery. So please consult your surgeon so they can guide you on what sort of treatment needs to be done. Again, if it is not a surgical problem, if it is just a skin condition like warts or a pimple or a furuncle, then they may just refer you to a dermatologist or give you a course of antibiotics to make sure that the treatment is completed. So how can you prevent these swellings? So in general, maintaining a good diet with adequate fiber intake and water intake will make sure you don't have any constipation related issues. And if you don't have any constipation or difficulty in passing stools, then you won't have any swellings developing in and around your anal region. If it is your skin conditions, then maintaining good personal hygiene, making sure that you don't scrub that area aggressively. So some people think that good hygiene means you have to scrub that area very aggressively with scrubs or with soaps. So please avoid doing that. So even if it is essential for you to maintain cleanliness in that area, it does not mean that you need to be very hardy while doing that. You can just clean that area with just plain water and soap, and you can make sure that you have good personal hygiene. And do not apply or spray any alcohol sanitizers or perfumes in that area. We've even had people who come saying that they have tried to make that area appear better, so they have tried to spray something. So since the lining is exposed in that area, that can cause to harmful results of the lining. So it can really harm the lining of the anal area if it is exposed to alcohol. So please avoid spraying anything in and around your anal area. And of course, your clothing. Do not wear extremely tight. I know that jeggings and tight clothing is very fashionable, but if you're expecting to work out, or if you're expecting to be in a seated position for a very long time, or if you are going to be working in hot, humid conditions, avoid wearing tight fitting garments, which will cause the sweat to accumulate there and cause skin infections, and also it can cause problems in and around your anal area. So wear loose, comfortable, preferably cotton clothing, which will make sure that that area is kept clean and dry. So also in this video, I have only talked about swellings in and around the area, and by that I mean small swellings that you can see outside even when you're not doing anything. So for example, there are some people who have swellings, or they feel that something is coming out when they are passing stools. So they say that when I strain a lot or when I cough, I feel that something is coming out from inside. So that they may have to push it back after passing stools, or that it may go back on its own after they have passed stools. So this is a completely different condition. This could be something related to piles or hemorrhoids, or this could be prolapse. So I will not be covering these conditions today. I will be talking about this in another video. So if you have any comments or queries, kindly mention them in the text boxes below, and we will address them in the next video.